This is Group 5's presentation on Chinese culture and healthcare. This is done by Jenna Johnson, Megan Murphy, and Megan Nations. Just a little introduction of the Chinese culture. It is very diverse. It spreads throughout America. I'm sure that all of us as nurses have cared for someone who is part of the Chinese culture. As you can see by the numbers, they were collected by the United States Census Bureau in 2010. Very large, but it continues to grow constantly. So this is why we really thought it was important to study the Chinese culture so that we can implement the appropriate culturally competent care. Some of the cultural attributes of China. Chinese culture, there are some variations throughout the region, but for the most part it was relatively uniform in some of the research that we performed. Two of the major beliefs is going to be Taoism and Confucianism. So what they believe is that as long as a person, whatever they do, it's up to fate. So these are very popular beliefs that a lot of people need incorporated into their care. Traditional medicine, this is still widely practiced. Things like herbal medicines, massage, all these, they need to be incorporated into the care if the patient wants them to be. They like to focus on the whole body, not just specific problem. They believe that stress, that this develops character and it repays a debt that was from a previous life. They are very independent. They rely on themselves and they try to be very self-sufficient. However, they believe that once someone gets older, it is the children's responsibility to take care of the elderly. Other cultural attributes of China, they strongly believe in the female force of yin and the male force of yang. They incorporate this in a lot of their different situations that they experience. Doctors, they try to avoid cutting into the body, so they will go and find different means for treatment. And as previously mentioned, they'll use different techniques. They'll use massage and acupuncture for treatment. Childbearing in the Chinese culture, throughout pregnancy and postpartum, this is considered a yin condition. So to treat the yin condition, they treat it with yang foods. For example, chicken, eggs, beef, ginger. So it's important to go as nurses to make sure that these foods are available for women who are pregnant or who have already given birth to a child. Postpartum women, they also are urged to follow the rituals that last between 1 and 3 months. So it's dietary restrictions, which is avoiding any of the yin foods, minimal physical activity, so a lot of them, they just stay in their houses for these 1 to 3 months. No hair washing, no exposure to wind, and to avoid the cold, which are all part of yin conditions. It is an expectation of the family members to care for the mother and the newborn after birth. So if there's no family members available to assist these new mothers, it may be the responsibility of the nurse to provide the care for the mothers and the baby, just to help them out, to be that support system for them. As previously mentioned, the mothers are usually confined to their houses for around 1 to 3 months after this birth. And restrictions of food, you want to avoid the fresh vegetables, sour foods, cold water, and fruits. For children, newborn to 17, it's the parents' responsibility to train and to love these children. They're very highly involved in the children's lives. The parents may seem more strict as some of our parents were. However, it's their way to show that they just want their children to be successful in life. And it may be different than how we were raised, is that love may be shown through actions instead of words. The adolescents in this culture, they're often expected to be responsible to care for the younger siblings, to take care of the house, and to help cook the meals. no matter what the family dynamics are, you need to, as nurses, we need to make sure to respect the families and understand that their way of communicating with each other and showing love, it may be different than how we do so with our families. An adult 18 to 64 years old, bedside nursing care examples, bathing, feeding, helping to go to the bathroom, that is considered responsibility of the family, especially of the women. However, the family planning policy that was put into place, this caused families to become smaller. So family members were not able to take care of their loved ones as much in the hospital because there weren't as many available to help provide 24/7 care. So this resulted in caregivers helping to be responsible for activities of daily living and personal needs. If there's any life-threatening diagnoses, for instance, cancer, this situation, the death, is discussed very little because they believe that by discussing it, they're causing bad luck and this will only increase the chance of death. But these decision-making processes in the life-threatening diagnoses, sometimes the family member's point of view is more important than the patient's because the family members, they are very much involved in the patient care and the decision-making processes. But then at the same time, terminal illness is discussed very little between family members. They do not like to talk about it. So it's hard where sometimes you have to find that balance of what's appropriate to talk about, when is it appropriate to talk about, and who is it appropriate to talk with. Older adults, age 65 and up, these are very highly respected individuals in the Chinese culture. Sometimes it may be hard to develop a trusting relationship. It may take some time, and it may be difficult to get them to open up to discuss the symptoms that they're experiencing. Also, some of these individuals still use Chinese herbal medicines, so it is very important as nurses study or try to figure out what they're taking and make sure it's not interacting with any of the medications that we as nurses are administering to our patients. Chinese filial piety is very important in this Chinese culture. So this is saying that the children, it is their responsibility to take care of their parents, to take care of their home. They believe also that diseases such as heart disease, Alzheimer's, that these are part of the aging process. So they don't look at it so much as a negative. However, for dementia, this is considered shameful within this culture, so the diagnosis is kept only within the immediate family. Some of these patients, they may use meditation, other religious practices such as prayer, and it's very important to respect these patients, respect their time, and allow them to partake in their cultural traditions, religious traditions, because that will end up helping them in the long run to help healing. Community nursing care, this form of care they're trying to grow it in this culture. There's so many challenges that these individuals face, that there's the increased health cost. The number of elderly is significantly growing. The prevalence of chronic diseases is increasing, and there's an increased need to have integrated health care. So community nursing was established to provide medical care, education, rehab, birth control, and disease prevention. And it's their goal to be able to provide quality care that's accessible and cost effective. However, they've found difficulty with this in that a lot of these individuals, they don't have confidence in the community health nursing because the lack of doctors, of nurses, and of supplies. So less than 25% of the number of individuals who visit a hospital visit these community health nurse centers. So even if they're closer to these community health nurse centers, they found that instead of going somewhere close, they've been going to hospitals to seek care. And just to summarize some of the very important parts, traditional medicines, it's very important to go to research to figure out if the patients are using traditional medicines and to try to incorporate it into the treatment and care if it's safe and if the patients want it to be incorporated. Families are very important in the Chinese culture, so it's important to respect the families, respect the patient's wishes, and to incorporate them into the decision-making processes. Again, discussing death is believed to cause bad luck, so make sure you discuss with the patients, try to figure out how comfortable they are with discussing the possibility of death, and to try to be honest with them, but also to respect their wishes. And remember, elderly are very highly respected. Take your time, build rapport with these patients, because it's very important to go and have their respect and have their trust. And here are references.